Hi, I'm Dr. Peter Kachajian, and we're going to talk about the new opioid guidelines. The P in the Pain is for the PITS program stands for pills or medications. There are lots of different medications: anti-inflammatories, muscle relaxants, anti-neuropathic medications, and of course, opioid narcotics. Opioids have become very prominent in the news these days because of the growing epidemic of opioid-related deaths and the mounting evidence that opioids are harmful to our bodies. Because of this problem, the Centers for Disease Control and Prevention came out in March of this last year with the government's first ever guideline for prescribing opioid narcotics. According to a recent CDC study, nearly 2 million Americans aged 12 years and older either abused or were dependent on prescription opioids in 2014. The CDC has intentions of limiting narcotics that primary care physicians should be prescribing, but it has implications for all physicians and healthcare professionals who prescribe opioids. If a patient needs much higher doses, it is suggested that they be referred to a pain management specialist like myself. It is not uncommon for pain management specialists to prescribing a higher dose of opioid narcotic than the CDC guidelines recommend. The key is that a physician or other healthcare professional who's prescribing opioids must do a risk-benefit analysis, looking at the patient's medical history, their social history, what medications worked for them in the past and what medications haven't. And they must monitor the patient with prescription monitoring programs and urinary drug testing, and so forth. Of course, the ideal scenario is to try to get a patient on as little opioid as possible or none at all, but that's not always possible. Remember, PITS is an integrative approach to treating pain. So before you start adding more and more opioid, think of other options to get the patient comfortable, like injections and therapy, and even surgery if needed. Opioids can be a very effective and a very beneficial part of a pain management program. But the CDC is absolutely right in what they're trying to do. Physicians and patients need to be smarter and better, especially when it comes to prescribing long-term opioid narcotics. For Pain is the PITS, I'm Dr. Peter Kachajian.